Monkeypox, a rare disease, is making its elusive presence felt with more than 100 cases reported in almost 20 countries. What is intriguing officials around the world is that it's spreading amongst people who have not traveled to Africa, where it is endemic. Which means monkeypox is regularly found in people in Africa in certain areas. This situation has cropped up an expected fear. Is this an indication of a new pandemic waiting to happen? Do we really need to be scared of it? Let's first understand what is monkeypox. Monkeypox is a rare viral infection which originates in primates and other wild animals. What are the symptoms, you may ask? The early symptoms include headache, fever, fatigue, backache, swelling of lymph nodes, exhaustion, and muscle pain. The most common symptom is fever, followed by a rash which is similar to smallpox, chickenpox, or measles. The face is the prime area where the lesions start to appear, followed by palms, soles, mouth, genitals, and it occurs rarely in the eyes. The recovery time ranges from 7 to 14 days as stated by the UK's NHS. We know what you're thinking. How do humans contract it? The most common route of infection is through contact with an infected animal or human or their bodily fluid. Transmission through sex is also a possibility. The other means can be broken skin, respiratory tract, mucous membrane, mainly eyes, nose, or mouth. One more important point to consider is that the infected human becomes a carrier of the virus even before the symptoms start showing up, making it very similar to COVID-19. What about vaccines? Presently, there's no dedicated vaccine available, but it's said that the smallpox vaccine provides 85% protection as the two viruses are very similar. The infected person should be isolated in preferably a private room so as to avoid contact with others. Medical professionals are recommended to use a PPE kit, and family members of the infected person should use masks. Let's trace back to where it all started. Its origin dates back to 1958. The very first case was identified by Preben von Magnus as a pathogen in crab-eating macaque monkeys who were being used as laboratory animals. In 1970, the first human case was recorded in the Democratic Republic of Congo, and by 1986, there were over 400 cases reported in DRC, formerly Zaire, a country in Central Africa. There are two main strains of the virus named after their place of origin: West African and Central African. And in May 2003, the first human case outside Africa was registered in the US. A kid who had purchased an imported animal came in contact with the virus through the animal. The number of cases rose up to 71 cases in the same year in 6 Midwestern states, which included Wisconsin, Indiana, Illinois, Kansas, Missouri, and Ohio, but there were no deaths. The largest outbreak of monkeypox was in Nigeria, with 172 registered cases in 2017, 75% of which were men in the age group of 20 to 40 years. So now let's come back to the original question. Is this the new pandemic we need to be worried about? Experts in the UK think not. UK Health Society Agency has said the risk is very low and UK is not on the brink of a national outbreak. And if we talk about India, there are no signs of the disease yet. Since 20th May 2022, the centre has begun surveillance at international airports and seaports. The samples of symptomatic travellers from Africa are being sent to the National Institute of Virology in Pune, where the health authorities are keeping tab on the people who have reported the presence of unexplained rash or have travelled to countries with confirmed suspects. But will this evolve into a life-changing pandemic? It is still too early to comment.